patient, Mr. Fuad, pains today?
Well, Ahmed, to assess the pain, I need to use the CPOT score.
What is CPOT score?
Well, there's some critical elements to doing the CPOT score. Let me tell you.
So Dr. Talat, from where we can start doing CPOT for Mr. Fuad?
So actually, Ahmed, the way I start is first I have to observe Mr. Fuad for 1 minute. After that, the next step is I ask the nurse, Julie, did you notice any change in the patient's behavior this morning when you did patient care?
Yes, doctor. The patients, when we turn the patients have grimacing, and then after that one, then when we do some wound care dressing for this patient, the patients become restless.
Okay.
So Julie, when did you give the patient pain medication last?
Ahmad, patients get morphine 30 minutes ago.
Ahmed, why are you asking this?
We usually need to know the patient's CPOT score before and after he given the medication to see the peak effect of the medication and if the medication is effective or not. So can we start doing CPOT score for him, Dr. Talat?
Yes, Ahmed. I will begin by observing his facial expression. Now, he looks tense, which is a score of 1, but he's also grimacing sometimes, which is a score of 2. So for CPOT, we give the worst score, so I'll give him 2 for facial expression.
Yes, Dr. Talat, what is the next step for facial expression?
So after facial expression, the next thing is to observe body movements. So he's not just protection, which is 1, he's actually restless and agitated and trying to take out his tube, which is a score of 2.
So Dr. Talat, after finishing facial expression and body movement, shall we assess the muscle tension now?
Actually, Ahmed, muscle tension is done last. Before that, we have to assess Mr. Fuad's compliance with the ventilator. And although he's coughing, which is 1, looks like he's asynchronous with the ventilator, that's a 2.
Dr. Talat, so we finished already the facial expression, then body movements, and also compliance with the ventilator. Can we assess already the muscle tension?
Yes, this is the last step in assessing CPOT. I will now assess his muscle tension to passive movements. Well, he is very tense and very rigid. This is a score of 2.
So now, what is the total score of our patient, Mr. Fuad, today?
So for the CPOT, we take the worst score from each category. So he scored 2 for facial expression, 2 for body movements, 2 for ventilator compliance, and 2 for muscle tension. So his total score is 8, which is the maximum score. So I think we need to increase his pain medication dose and frequency.
Yes, we can.